Hello, everybody, and good evening. I'm Dr. Charlotte Norton, and I'm here with you this evening to talk all things weight loss medication. Obviously, we'll wait a few moments for some of you to join us. As I said, I'm Dr. Charlotte Norton. I am the medical director at the Slimming Clinic. So I am all things weight loss. I'm going to talk today a bit about medication. We've had some questions sent in already again today, which is fantastic. So I'm going to cover some of those, but also if you're watching and you've got a question you want to ask, whether you're on weight loss medication, whether you're thinking about weight loss medication, whether you've heard something about weight loss medication that you just want to find out about, please do feel free to ask any questions. Pop your question in the comments, and I'll endeavour to answer it as best I can. As we go through. So as I said, thank you very much for joining me this evening and taking a little bit of time out for your evening. Weight loss medication, there's lots and lots of information out there about it at the moment. So it's just a great chance for me to talk to you a little bit about it and answer your questions. Whilst we give it a moment or two for anybody else who's going to jump on and join us today. So I've been working in obesity and overweight management for, I was trying to work this out last time. I still can't remember in my head when I started. So for many years, and it's a real passion of mine, and it's fantastic that we have such an array of tools that we can use to help anyone that's looking to lose weight and do it in a safe and appropriate way. But the focus of our sort of talk today is a bit about weight loss medication. So we did a Facebook Live a few weeks ago. So if you saw that, great. If not, I'm just going to really quickly recap. At the moment, there is a variety of weight loss medication that's available out there. And what's got really popular at the moment is weight loss injections, of which there are a couple available. The two key ones, that are currently licensed for the treatment of overweight and obesity, i.e. a license for weight loss, are Wegovy and Mounjaro. So they're the two we're going to talk about mostly today. Wegovy contains a drug called semaglutide, and Mounjaro contains a drug called tirzepatide. So they're both a similar class of drug with similar ways they act and work, but they are separate and different. And you probably would have heard of Ozempic. Lots of us have heard of Ozempic. Ozempic is the same active drug as Wegovy, semaglutide, but it came to market before Wegovy, which is the one for weight loss. So Ozempic came to market actually for the treatment of diabetes, type 2 diabetes, but you do hear about it, and some people do still source Ozempic, but the actual drug that we use and prescribe at the Slimming Clinic is Wegovy. So I won't launch too much right now into the difference between the drugs, because we did cover that last time. But if anybody wants me to recap it, please do ask. But what I'm going to do is go through some of the questions you've kindly sent in. And I think one of the things that's been quite big, is being quite heavily publicised in the news, is some changes to the way that people can access weight loss medication, and mostly the injections. So the injections have or a weight loss medication for that you inject to help you lose weight have been around for a while. Actually, it started off in about 2017 or really 2015 when Saxenda came to the market, the first injectable weight loss medication. It's very rarely used now, but Saxenda is still around. But more recent, with Wegovy coming to market, and most recently Mounjaro, lots of people have been very interested in this medication. The results of weight loss with taking these medications, both in the clinical studies that are done before a drug comes to market, and also in real life, people's experiences have been brilliant. There's some fantastic weight loss results that can be achieved, and that's meant all of a sudden there's been a variety of ways you can access and get that medication. Now, these are prescription medications, so that means a prescriber, a suitably qualified and trained prescriber, should assess you and assess information about you, your health, any medical conditions you may have now or have had in the past, as well as any medications you're taking, to then prescribe it for you. So they always need the oversight of a prescriber. But what's happened recently is there's been a lot of online pharmacies and online options for sourcing this drug. And what they're using is, instead of you having an appointment with a clinician through a video, or submitting lots of types of evidence with your online request. Some of them are simply using just a form, which means that obviously you go on, you enter your form, and the vast majority of us would be honest and would, would be, truthful about our medical health and our weight, etc. But there have been instances when people who maybe shouldn't have sourced this medication have managed to, and that's people with things like a history of eating disorders who it really wouldn't be safe for them to take this type of medication. So what that means is that the General Pharmaceutical Council, who regulate pharmacies and how pharmacies work and behave and the practices, have said actually a form fill without any validation of people's medical health or their weight and their appropriateness for the drug isn't suitable anymore. So there needs to be far more robust ways for checking that somebody is correct and safe for the drug. I mean, that's the key. That's why we do as clinicians, that's why we assess you, is to make sure it's safe and right and you're going to get your best results from taking the medication. So some people are saying, well, what does that mean for us here at the Slimming Clinic? Because we have two options. We have a appointment-based option, which we've been doing for years. That's been the bread and butter of what we've done for many years. Is you have now a virtual appointment with a doctor, with a clinician, and we have longer ones where people want to really dive into their diet and lifestyle alongside the medication, and we have more shorter ones for those who maybe have got a busy lifestyle and just want to sort of just jump in and have the core elements that they want to talk to the doctor about with regards to their medication. So with those types of appointments, you do fill in a bit of information before you attend. Then you come to the appointment, you speak with the clinician, and then you get an instant decision on the drug that's suitable for you. The doctor can let you know there and then what medication is the best one for you, and if you're happy to go ahead, your prescription can be authorized there and then, and hopefully on its way to you even the same day if it's in time for our pharmacy to post it out. But there is also the online option. Now, there's no change to the way we do that because we are a CQC regulated service. So we're not an online pharmacy, although we have our own pharmacy. We're actually a CQC regulated weight loss clinic. So the way that we have to assess our patients is obviously robust because we're inspected by the CQC. They're going to make sure that we're working in a safe manner and that we've got the right checks and balances in place to ensure that we're delivering a good and safe service to the public. So what that means is where we have our online prescription requests. So, you're going on to request the medication you would like. Yes, you do fill in some information yourself, but then we make you submit lots of pieces. I'll say lots of pieces, that makes it sound like it's exhaustive. A few pieces of information that help us validate you are who you say you are. So some sort of ID evidence, something that we can see that it's you, and we can see a full-length picture or maybe even a video of you, so we can see your sort of size and frame, as well as maybe taking your weight measurement as well, so we can check elements of that. And also we try as much as possible to have an open dialogue with your GP. Now, I touched on this last time, this is private sector to medication, so we will not automatically inform your GP, but we do discuss it with you, and we have a short video for those patients that wish to request online to understand why we prefer to let your GP know. And again, that creates a two-way dialogue as well, so we can ensure that the medication is safe and appropriate. So to answer that question that someone said in, what changes that to what we're doing at the Slimming Clinic at the moment, there is no change. You can continue to interact with us in the way you do. Now, I'm a doctor, so if you ask me, I'd say come for an appointment so that we can, really get to know you and understand your health and, the goal you want to achieve. And, we can give you far more tips and advice on how to make some changes alongside the medication to get your best results. But, the world is changing. People are busy. People want to be able to, look at stuff in the evening when they're winding down from work, or the children are going to bed, or you're sitting there. So, we absolutely understand that. So we're trying to, ensure the service can be as convenient for you as possible, alongside making sure that we've got the medications that our prescribers are happy to, that we've received everything we should have to know that we can prescribe for you correctly and safely. So you can still get your medication, but I would advise you, whether you're a patient of ours or not, to go for a service that is robust, that makes sure that the medication is correct for you. And we may see a change. Some of these online pharmacies might change what they're doing, and you never know. More and more appointments with clinicians and prescribers would be great. And I think there was a very sort of similar, somebody asked us a question, well, what do the changes mean? I'm no good with technology, or I just I want to just order online. And I totally get that. As I said, I get the convenience of it. Amazon has got a lot to answer for. We're really used to quickly, shopping online, right, that's what I want, and off we go. But again, just to stress, these medications are really safe, great results, but it is important that whoever prescribes that medication for you knows enough about you to make sure that that's a safe choice. Now, we, in answer to ours, we try and facilitate that to be as easy as possible for you. So, if technology is an issue and you're struggling, our clinicians are happy to have a telephone call to talk about as much as we can over the telephone. And then we've got a fantastic support team who can help you, submit those final bits of evidence or get online with a video call and talk you through it so that we can get those final checks. So there is lots of different ways that you can interact, and our team are always happy to help. We send a lot of information by email, but we can send it in written form if people want that. So we're real human beings here. We're not just a faceless online pharmacy. We're real human beings. You can pick up the phone, you can talk to our team. We can find a way to make sure that we can get everything you require, to feel safe and to feel like you've picked the right medication and to feel like we're with you, on this journey. We all know that weight loss medication is relatively expensive, compared to especially when you're still seeing it in the private sector. Is an investment in it financially and an investment in time. So you want to get the most out of that. If you're committing and you're going to take this step, you want to make sure you get the most out of the medication that you're taking. So that's sort of about the current changes. So again, we talked about this last time before this was actually released, this press release, and it is important that you make sure that somebody is looking at you holistically and making sure that even though there's only two sort of drugs here, Wegovy and Mounjaro, one might be better for you than the other, and that little bit of information that you didn't think was relevant but actually could be really relevant is really important to make sure you tell us, even if you think that doesn't seem relevant. Sometimes it really can make the difference to making sure you get your best medication. So I've got one here about, can weight loss medication be used by people with health conditions such as diabetes? Now, this is a really interesting one, isn't it, diabetes? Because there are two forms of diabetes, first of all. There's type 1 diabetes, which usually starts in childhood and is a condition where your body doesn't make the insulin, the hormone that's required to manage your blood sugar. So usually from a very young age, you go on medication such as injectable insulin itself that manages that for you. So weight loss medication as a whole, in terms of these types of medication, isn't suitable for those people with type 1 diabetes on an insulin, because as I sort of briefly mentioned at the beginning, these drugs first came to market as a treatment for type 2 diabetes, which is the adult onset diabetes that generally comes usually as an issue where your body has been having to manage high sugar levels for such a long time that your body actually becomes insensitive to it, and your insulin, although it's being produced, isn't working properly, so you're getting high levels of sugar in your blood even though you shouldn't be. And obviously high sugar in the blood is bad, it's not good for your body, for your organs, so again, that's why it needs to be treated. So if you're taking an insulin type medication, which you can do sometimes with type 2 diabetes that hasn't responded, they don't advise you to take, or we don't advise you to take, a medication such as Wegovy or Mounjaro, because they also have an ability to have an effect on blood sugar. So if you're taking an insulin, which is driving your blood sugar, and you're taking one of these, there is a chance that your blood sugar could go too low and you could have what's called a hypoglycemic event, which can make you really poorly and unwell. Now, that being said, there are some specialized diabetes centers where somebody's managing your diabetes very closely that might be able to co-prescribe these, because they're able to really look at the minutiae of how your blood sugars respond to things. So that's not being said that this is an absolute definite no, but it's usually only if you've got that high level of care and somebody monitoring you effectively that you can go on that medication. But for the vast majority of people with type 2 diabetes, where the first line is actually diet and lifestyle changes anyway, going on to these types of medications can actually be really beneficial, because not only will it help you manage your weight and achieve your weight loss goals, but by its nature, sometimes losing weight and changing the environment within your body can actually help reverse the type 2 diabetes, and actually you can end up with with no longer having that diagnosis. And we see that we see that a lot actually with patients that lose weight, whether they're using these medications or not, because you're changing what you're eating and how you're managing your body. Type 2 diabetes can be, reversed and no longer an issue for you. So, if you've got type 2 diabetes or you're not on an insulin type product, then do have an appointment with the doctor, talk it through, find out what medication that you're on. And actually this losing weight and using these medications can actually be a really good adjunct to your diabetes care as a whole. And often, your practice nurse or whoever manages your diabetes will actually be really supportive of you taking this medication, because we know the beneficial effects it has on blood glucose anyway. Maintenance. The next question, sorry, is there a maintenance program? I'm worried I'll regain the weight if I stop the medication. So there's two questions here. So will I regain the weight when I stop the medication? And we get asked this a lot. And the answer is no, if along your journey of losing weight and taking the medication, you make the changes and you take the steps to adjust what you're eating. So change the food you're eating, learn about portion control a little bit more, find out about how much is the right amount to eat, and institute changes, moving a little bit more, changing your mindset. If you make those changes as you go alongside your weight loss program, and you institute those to become part of your lifestyle, then no, you shouldn't regain your weight, because you should keep those changes going. If you've through your weight loss program you've changed what you eat, then that's brilliant. Maybe you started moving a bit more. Maybe at first when we lose weight, sometimes it can feel really hard, especially we can feel like we're lacking a bit of energy. And as you go and as you gain a little bit of confidence and you gain a bit more energy, people often pick up a form of exercise. Now that's not running a marathon, that can be any form, just even walking that they enjoy, hitting that 10,000 steps every day, keeping that up afterwards. All those positive changes that you make should help you keep that weight off, and that's what we love to do at the Slimming Clinic. We love to prescribe you the medication, but we love to put all of that change around side the medication to make sure again, that's how you get your best results, by putting that all together. We see it time after time with patients. We see it time after time in clinical studies where there's that behavioral therapy or behavioral change alongside a medication. People do get really good results and long lasting results. Now, to say, is there a maintenance program? So with these medications, obviously they're relatively new to market, so there aren't people who've been on them for years and years and years. But what we know is that each of them have a level of license for maintenance for a different amount of time. So you can use the medication to help maintain weight for a while. And sometimes the doses might differ there. So you might be on the highest dose when you're losing weight, and you might come down to a lower dose when you're maintaining, to kind of start to reduce the amount of medication in your system. But there is a level of maintenance dose. Now it depends on you, it depends on your weight at the time. The key is that what the overall aim is to make sure as you get towards a healthy BMI or your goal weight, is that we don't use the medication to take your weight too low. And that's where the conversation around stopping medication starts to come. When you're in that lovely healthy BMI or where you want to be, it's about, when do we start reducing the dose? When do we start thinking about stopping? So it's not a case of, right, you've hit your goal, right, that's it, off you go, cold turkey now, no drug tomorrow and good luck. It is about going through that period of maintenance, adjusting the dose, starting to see how things go when you're taking a little bit less medication. Do you feel in control? And all of that it comes as part of the care we offer at the Slimming Clinic. And alongside what we've discussed at the beginning about accessing the medication, you can absolutely find ways to access the medication and take it. If you just take the medication, you will still achieve weight loss, even if all you do at the start is just eat less of what you're eating now. Inevitably, with the simple science of weight loss, and I say simple science because it is not simple, and I fully appreciate that, but if you're taking in a bit less, then you will lose some weight. But what we do at the Slimming Clinic, and we feel so important, is, like I've said, putting all of that together. So again, if you've just been taking this medication on your own without really any support, and you get to the end of it, it's hard sometimes to know where to go, how to make those good changes. And we have we've a fantastic dietitian on our team who loves to work with people about really getting into the nitty-gritty of making those food changes. And certainly isn't there to chastise you as to what you're eating now. It doesn't matter what you're eating now. What matters is what we're gonna what you're gonna change, and fits your lifestyle as well. We've all got to be realistic about how we live, the family at home, and things like that. No one's going to expect you to be cooking yourself a separate dinner than the rest of your family. So, there's lots of ways to make sure that you put all that together to get your best results. So, yeah. By no means, do we sort of leave you out there, to regain your weight when you get to the end of your journey. And it's a great time to be excited. People worry about that. I'm like, gosh, wow, great. What that means to worry about when you're at that goal weight, when you've got where you want to be. Let's worry about it when we get there, but let's really celebrate getting there, especially if it's been something you've been trying to get to for a long time. It's a real achievement. You should be really proud of yourself. The medication helps, but you are doing the work. So, absolutely. Somebody has asked, can I switch from Mounjaro to Ozempic? Will that boost my weight loss? So again, Ozempic, you wouldn't want to go on Ozempic necessarily because although it's semaglutide, it doesn't go to the same dose or as high as Wegovy. So you want to be going on Wegovy, not Ozempic, but I understand the premise. So yes, you can change between the drugs. Of course you can. And obviously it's about thinking why. Is it just because you want to lose more weight? And then you have to think about, well, it is, what is the reason I'm not losing as much weight? Again, the medication is helping you control your appetite. It reduces how hungry you feel. It slows down how quickly the food moves through your gut, so you feel fuller, so your portion sizes go down, you feel less like eating. So it helps with that element. But sometimes actually weight loss slowing down or not going as well isn't simply just you need to eat less, so take a higher drug or a different drug. Sometimes it's about what you're eating, when you're eating, how you're moving. There's lots of things to consider. So I wouldn't simply just say switch drug to get more weight loss. It's about, well, is the medication doing what I need it to? Do I feel in control of what I'm eating? Do I feel in control of my appetite? Have I stopped that mindless eating I was maybe doing, or that snacking when I know I shouldn't have been? Or, if all of that's working, then actually you might not need to switch the medication. It might actually be looking at what you're doing. But you can switch between the drugs. Usually there are no studies that show you can go from this dose of this drug to this dose of that drug. You will have to start at the beginning of a dose of each drug to titrate to the right dose. Again, that's not necessarily to the detriment of your results, because again, as long as you're in control of your eating and your diet, you should still be seeing those weight loss changes. But yes, you can. Can I use weight loss injections with other diet plans such as 5-2? So yes. So we aren't prescriptive at the Slimming Clinic as to what diet plan you have to follow as such. We don't give you a rigid, you must eat cabbage soup on this day or that day of the week. We work with you around what you like to do. 5-2 is an example of an intermittent fasting style diet, and there are mixed studies about it. There's sometimes we look at intermittent fasting and actually it's really beneficial for weight loss. There are other studies that show it maybe it wasn't so much. So but if it's a way of managing your eating and your diet that works for you, that helps you feel in control, you enjoy that feeling. Some people enjoy that sort of feeling in the fasting time of not feeling so full or uncomfortable, then yes, we can work with you around that. There's no harm in having an eating type pattern, as long as, and this is again another key thing with this medication, as long as you're eating food, you're giving your body regular nutrients, to keep it working. It does need fuel, the body, but it needs a good, broad balanced diet. We see all too often people using this medication, eating less, but not eating a variety of things, missing out on some of those vital vitamins and minerals. We talked about on a previous one about hair loss, and one of the parts that we're seeing with that is people not eating enough. You're starting to get vitamin deficiencies, again, you'd have to be taking the medication for a while, but all of these things are really pertinent and really important. So it's all about making sure you're giving your body your fuel. Plus, I say this all the time, weight loss, to burn the fat, which is what we want to get rid of when we're losing weight. We want, the fat to go. Your body has to actually do something. It's a metabolic process. So you've got to give your body the fuel to do the fat burning that you want it to do. If you don't give your body fuel and it starts to feel like it hasn't got enough fuel, it slows down its metabolic processes to, conserve its energy. So you won't get the most out of your weight loss. So again, just like a car, if you put in really good fuel in it, you're going to get your best. And if you're putting, the economy fuel, you don't put nothing, you don't get your best. And it's very simplistic, but you think about your body in that way, and it helps to sort of think about what you're eating and what you should be taking. Somebody else has said, I usually inject the fat around my waist, but it's getting itchy. Okay, so these are a weekly injection. Saxenda was a daily. These ones are weekly injections. So you are injecting yourself. This medication comes in an extremely non-daunting pre-injection pen. You've got this pen where the medication is in, and you use a fresh needle every time you inject yourself. These needles are tiny, they're really thin. They are maybe the width of a fine piece of cotton, so they're really small needles. And so if anything, you might feel a tiny scratch as it goes through your skin, but it should certainly not be painful. And as the drug goes in again, it's not a stinging or a burning feeling you should be feeling. Sometimes people catch a little blood vessel in the skin when they inject, and that can sting a little bit, but it certainly isn't highly painful. So this question about your weight, so waist, the fat of any waist. So where you inject, we generally suggest you inject an area where you can pinch a good inch. You want it to be going into the subcutaneous layer, so the fat underneath the skin. So you want to be able to grab an area where you've got a bit of fat under the skin to inject it. So the waist, the thigh, under the arm. There are lots of places where you can inject and pinch that inch to inject. So there's a couple of things about itchiness of the skin. So number one is please make sure you're using a clean needle each time. You don't want to be injecting with a dirty needle. So use a fresh one each time. You should always be supplying, whoever's giving you this medication should be supplying you with a brand new fresh needle each time. Make sure the skin's clean, and also alternate where you inject. Don't inject in the same spot each time. Try and pick a different place again, so you don't irritate the skin, because obviously you are creating a little injury in the skin when you're injecting it. So again, you want to make sure that you vary the site that you inject each time. Now, some people can have, rarely people can get a reaction at the site of injection, and that very much depends on what that's like. If it's just a bit itchy and a bit red after you inject, and that goes away and progresses no further, then usually that's absolutely fine. Sometimes you can switch drug and see if that makes it any different. If you get a particularly nasty, response at the site, really red, uncomfortable, or there's a risk it's got to be infected, then it's absolutely worth speaking to a doctor. Obviously, if you're a Slimming Clinic patient, whether you're an appointment or an online, you can absolutely speak to a member of our team about it, and there can be ways to manage it. But yeah, I would say just making sure you're varying the site, keeping the skin clean. You should really not have too much issue. Obviously, when you create injury, a chemical called histamine gets released into the system as part of our immune system, and histamines will make things itch. So sometimes some people use an antihistamine and it helps, but again, I won't make that broad statement. I'd like to review you before I'd say it, but there are things that can be done. It shouldn't be a reason to not take the medication. A funny one here I've got on the one sent in was, I've read that Mounjaro will stop my contraceptive pill from working. Is that true? A really good question. So no, it won't stop it from working as such. So the way these medications work is they slow down. Part of the way they work is they slow down gastric transit. So that is how quickly the food moves through your system. So therefore, when you're taking an oral form of contraceptive pill, there has been some question in the studies, well, does that affect how well absorbed the contraceptive pill is? So although there's no clear-cut answer to it, because again, it's not something people want to really test in a study as such, what they recommend with Mounjaro is, in the first 4 weeks that you start it, if you are taking an oral contraceptive, either switch your contraceptive, which not everybody wants to do, use an additional barrier form of contraception in those first 4 weeks when you start it, and in the first 4 weeks of each time you raise the dose. So again, the dose goes up as you go through your prescriptive time. So when you switch dose, again, for those first 4 weeks, that first month of that medication, make sure that you use an extra form of barrier medication. Our team, we always ask about your last menstrual period if you are somebody who's having cycles and things, because again, we want to make sure that you're fully aware of this. And also, again, like with most medications, they're not often tested in pregnancy because you don't want to risk anything. So there's no clear answer about their effect in pregnancy as such. So again, we just want to avoid anybody falling pregnant whilst they're taking the medication. So again, it's being mindful of that, and our team will talk you through that if, when you come to your appointment or you answer your medication, you tell us you're on that form of medication. I've got a question here. So when you have a BMI under 30 but are still overweight, will we struggle to continue with ordering the medication? I was 2.5 stone, BMI under 30, now I've been concerned. Okay, so right, so no, so when we talk about the BMI, so I think the question here is, I'm starting to lose weight, my BMI is coming down, am I going to stop being prescribed? So as I mentioned, the medication is licensed for maintenance. So that means, just because you've got to your goal BMI doesn't mean we're going to stop it. So we can use it to help you maintain your goal weight. When I say we don't want you to be going to a BMI that's too low, for us, our ultimate cutoff is 22.5 at the Slimming Clinic. If your BMI is getting less than 22.5, then that's usually when we start to really want to stop the medication, because we're in the business of helping you lose weight and look after your health. We're certainly not pushing you into the underweight category where there could be risk to health from the other side of things. So that's not where we go. So I wouldn't be concerned about that. There's still, there's a long way to go. And I guess it does depend where people start from, but, you need to be BMI of over 27 to start this medication. So if your BMI is getting down to 22.5, you're certainly doing really well. Hopefully you're feeling, really towards the weight you want to be. So yeah, absolutely don't feel afraid to be honest with our team, make them know sort of what where your BMI is going, because we want to be celebrating the fact that your results are going really well. So yeah, there's a long way before we would say somebody wasn't suitable for the medication. Someone said, can I request smaller needles? Yes. So again, it depends which medication you're on. So when you order Wegovy, it comes in a box that has both the injection pen and the needles. So you get preset size needles that come with that. So if it's Wegovy and you don't like the needle, then yes, if you're a patient of ours, absolutely, we have a variety of needles in stock that we can send you. And again, with smaller sizes. Obviously, there has to be a certain level of size because their medication has got to get through the needle and into the skin, and go through. But yes, with Mounjaro, yes, we have a different type of needle. It doesn't come with them. We give you the needles. So again, yes, there is a smaller size that you can request. Both in slightly in length and ever so slightly in width. So yes, there are different sizes if you're really struggling, but again, they are very small needles. So, hopefully you shouldn't experience too much issue there. Okay, well, hopefully I've come to the end of the questions I've got, unless anybody else has got one they want to ask now. But I hope that's been informative and interesting, and just, again, it's great to have some questions to have come to this to ask and answer for you. So there's lots of information out there about this weight loss medication, and the overall message is you can get some fantastic weight loss results with this medication. So whether you are a new patient or whether you are a existing patient, we've got a fantastic offer at the moment with free postage and packaging of your order. So if you're an online patient and you're ordering online, you've got free postage and packaging at the moment as well. And we have some great offers for patients who are new to us as well. So please do, don't feel afraid to have a look around our website to work out which way you want to engage with us. Our team of prescribers and doctors here are really friendly, happy to, they love what they do. They've been working in this sector of medicine for such a long time. They love helping people, achieve their weight loss results and get to, who they want to be and get that goal weight. So, please do come along. And if you've got any questions that you haven't asked today that you feel you don't want to ask here, then please put them in the comments, and a member of our team will get back to you at another stage as well. So thank you, everybody, for joining me this evening and disrupting your evening. I hope you found it informative. We'll be doing another one of these shortly as well, which will be publicised. And again, please send in your questions beforehand if you want something specific covered. Otherwise, I hope everybody has a lovely evening, and thank you for joining me.